Hi everyone. Today I'm going to be talking about how undocumented immigrants interface with the U.S. healthcare system. Here are Lester and Violet. Let's try to figure out a plan for them. Throughout the video, I'm going to be referring to undocumented immigrants as UIs for short. First, let's talk about insurance and access to healthcare. Many undocumented immigrants are uninsured. In 2017, among the non-elderly population, 45% of UIs were uninsured. So what are the limitations to insurance coverage that this population faces? First, they're not eligible to enroll in Medicare, Medicaid, CHIP, or to purchase coverage through the ACA marketplace. Second, they also have limited access to employer-sponsored coverage, since undocumented immigrants are often employed in low-wage jobs and industries that are less likely to offer employer-sponsored coverage. So UIs definitely face significant barriers. But what healthcare options do they have? Some may be covered through their employer or as a spouse or dependent of an employee. Some are also able to purchase private insurance outside of the ACA marketplace, but this is often too expensive for most UIs. For students, they may be able to enroll in student health programs. 6 states and DC cover income-eligible children regardless of immigration status through their Medicaid program. And these are California, Illinois, Massachusetts, New York, Oregon, Washington, and DC. Additionally, the undocumented immigrants are eligible for emergency Medicaid funding, but this is only used for stabilizing patients that are in acute emergencies, so it's not a long-term option. Now, let's say all of these are still not an option. What recourse is left? Well, UIs can obtain free or low-cost care through community health centers. However, these are often limited to preventive and primary care. They can go to federally qualified health centers, FQHCs, which are very similar to community clinics but receive government funding. They can go to free medical and dental school clinics. And then finally, they can go to the hospital for emergency care. And this is because the 1986 Emergency Treatment and Labor Act, EMTALA for short, requires hospitals to provide services for emergency care regardless of insurance or immigration status. Another significant barrier facing UIs in the realm of healthcare is fear of being reported. This hinders many from seeking healthcare until conditions become severe. However, law enforcement would only get involved within the healthcare setting for UIs in rare instances. Hospitals are not required to share immigration status with law enforcement unless required by valid court order or warrant. In fact, HIPAA actually prohibits disclosure of protected health information such as immigration status without patient consent. The only exception is when the PHI constitutes evidence of criminal conduct that occurred on the premises. So unless the patient commits a crime at the clinic, the PHI such as immigration status should not be disclosed. Now let's circle back to Lester and Violet. What should be our plan of action given their undocumented immigrant status? First, we should not disclose their UI status to law enforcement because it would breach HIPAA regulations, and also because it is important to maintain trust with this vulnerable population. Second, since the family now lives in Chicago, Lester and Violet would be eligible for Medicaid given Illinois' expanded Medicaid program that does not consider immigration status. So we should help them sign up for that coverage. And that's all. Now you can boast to your friends about how much you know about healthcare access for undocumented immigrants.